Hello, my name is Katie, and this is my final capstone presentation. I focused on the critical issue of limited mental health resources here in our local community for my public health issue. Mental health plays a vital role in how individuals think, feel, and function in everyday life. This issue really stood out to me because I've personally witnessed how the lack of timely, affordable care can affect individuals and families in both urban and rural areas. Access remains a challenge, and it leads to untreated conditions, overwhelmed emergency rooms, and poor health outcomes. Personal and professional experiences have really fueled my passion for to advocate for mental health support. As a future nurse, I believe I have a responsibility to bring attention to this crisis and push for change. I've identified several systemic inequities, a shortage of providers, shortage of services, and many access barriers to treatment that contribute to stress or self doubt. The demographics of this issue include uh, many individuals, many adults in Nebraska, about 325,000 people, over 17% of the adults in the state experiencing mental health issues annually. 88 of 93 counties have been designated mental health professional shortage areas, and 18.3% of children aged 13 to 17 have been diagnosed with conditions such as ADHD, anxiety, and depression. In Nebraska, and especially Omaha, we're facing a serious shortage of mental health providers, from psychiatrists to therapists to inpatient services. The demand for psychiatrists and therapists and inpatient beds far exceeds the supply. Historically, Nebraska has struggled with limited mental health workforce. In the early 1900s and 2000s, state hospitals began closing and downsizing in a nationwide deinstitutionalization trend. This led to community-based services taking up more responsibilities for mental health care. Rural isolation, low provider incentives, and stigmatization have long discouraged mental health investment. In recent years, research has underscored persistent recruitment and retention problems for providers in rural Nebraska, as identified by Wantable and Galloway. And historically, Nebraska has been struggling, frankly. Some of the causes for the mental health crisis are limited local training programs, rural geography and remote areas, the stigmas that surround mental illness, and the mental health resource crisis stems from a combination of these factors. A widespread shortage of mental health professionals affects rural and urban areas, while limited local training problems or programs further restrict the workforce pipeline. Some solutions that I found in my research were mobile crisis intervention services, which has been established in some different areas, which includes direct response calls or response to crisis calls, and telepsychiatry, which it would be a central hub connecting emergency departments with licensed therapists. In my time during my program with the accelerated nursing program, my effective communicator experience, the first one is when I cared for a patient that was intubated in the ICU following an amphetamine overdose. Although the patient was nonverbal, I maintained communication throughout the experience, explaining the procedures I was doing and my presence, also supporting his wife, who was very frightened. And the experience really taught me that effective communication involves more than just words. It requires active listening, emotional awareness, and adapting to the needs of patients and families. These skills are vital, I believe, in addressing the mental health crisis by fostering an understanding, reducing stigma, and advocating for better resources through compassionate, clear dialogue. The second effective communicator experience I had was when, at an outreach event at New Vision's homeless shelter in Council Bluffs, I spoke with a man who was outside and not participating in the screening programs we were offering. But when I engaged in a conversation with him, he shared his story of his job loss, homelessness, and stolen medical supplies for his prosthetic leg. The conversation revealed that the real world impact of healthcare disparities and the importance and presence and empathy I learned that effective communication means listening without judgment, which I think he felt when I was listening to his struggles, and using compassion to build trust. These skills are essential in addressing the mental health crisis as well as they help uncover barriers to care and make individuals feel seen, supported, and empowered to seek help. For my first reflective individual experience, I was caring for a patient on the orthoneuro floor, and I observed and assisted with the care of the patient who was on comfort cares. We focused on maintaining his dignity and quality of life at the end of his life. His family members were there, and we tried to limit the amount of time we spent in the room, and the patient had refused any further assessments or anything like that, and we were just providing whatever comfort we could. This experience challenged my previous mindset that nursing is only about helping patients recover from an illness. I learned to reflect on each patient's unique needs, even when the recovery isn't the goal. Being a reflective individual means continuously evaluating how I care for others and recognizing that true care includes emotional, spiritual, and comfort focused support. These insights might help me address the mental health crisis by having a willingness to adjust my approach based on each individual's needs and lived experiences. My second reflective individual experience was providing holistic care for a paralyzed patient. While caring for a post-op patient recovering from cauda equina syndrome, I initially focused on the physical healing, his post-operative assessments, and things like that until he instigated a conversation about his previously active lifestyle and fears about the future now that he was paralyzed. This helped me realize that I'd overlooked the emotional and psychological needs of the patient. This experience taught me that the value of holistic care and self-reflection. Being a reflective individual means going beyond clinical tasks to understand the whole person, emotionally, socially, and spiritually. These insights are essential in addressing the mental health crisis that I focused on, and that they would help guide compassionate, individualized care and advocacy for services that support all the aspects of a patient's well-being. Being a change agent, I learned about during a clinical experience, again at New Vision's Homeless Services. I assisted in providing wound care to a man who was living in his car. He was unable to walk into the shelter due to severe foot and leg wounds. This experience exposed the deep systemic issues tied to homelessness, poverty, and the lack of healthcare access. I learned that being a change agent means going beyond immediate care. It involves critical thinking, advocacy, and collaboration to address root causes. The team that we were working with really pulled together, went out to the vehicle, helped with care of the patient's wounds, and even helped organize an appointment for him to visit a clinic nearby later that afternoon. These insights inspire me to address the mental health crisis by promoting equity, influencing policy, and working across disciplines to push for sustainable solutions that support these vulnerable populations. My second change agent experience involved caring for a child at Children's Hospital who had been newly diagnosed with diabetes. He and his family were there. They spoke Spanish primarily and needed to have diabetes education due to the new diagnosis. This experience really highlighted the importance of cultural sensitivity, empathy, and effective communication in healthcare. I participated while the diabetes educator came to the room with an interpreter to ensure the family understood the diagnosis and the education in order to manage this patient's diagnosis of diabetes in his life. I learned in this experience that being a change agent means advocating for equitable care by meeting patients where they are, linguistically, culturally, and emotionally. The insights empowered me to address the mental health crisis by promoting inclusivity, challenging and working collaboratively to ensure all individuals receive the care and the support that they need and deserve. In conclusion, Advocating for mental health as an educated citizen, my capstone journey has deepened my understanding of the mental health resource gap in our community and the role I can play in addressing it. These personal and academic experiences have helped me grow as an effective communicator, a reflective individual, and a change agent. I really learned that meaningful change starts with compassion, being aware, and listening to the needs of the patients. As I move forward in my career, I am committed to advocating for holistic care of patients, equitable care, and accessible mental health care, especially for those that are most often overlooked, like these vulnerable populations that I've encountered. Here is a list of my references. Thank you.